Welcome to Palace University. This is HIV and AIDS, Prevention, Infection Control, and Florida Law, a one-time course for every Palace team member. Together, we'll learn how the virus spreads and how it does not, the everyday precautions that keep us all safe, and the Florida laws that protect every resident's privacy and dignity. Florida law requires every team member in our communities to complete a one-time HIV and AIDS education course, and the standard expectation is to finish it within about 30 days of starting. You take it only once, it is not repeated every year, and it follows you if you move to another covered facility. Palace provides this training and documents that you completed it, and the Department of Health may review those records. This class meets that requirement. Let's start with the basics. HIV is a virus that attacks the body's immune system, the defense that fights off infection. If it is not treated, it can slowly weaken that defense and advance to AIDS, its most serious stage. But here is the good news that shapes everything else. Today, HIV is a manageable, chronic condition. With modern medicine, people living with HIV lead long, full, healthy lives, including many of the residents we are proud to serve. HIV lives only in certain body fluids: blood, semen, vaginal and rectal fluids, and breast milk. It spreads only when those fluids get into another person's body. In real life, that means a few specific routes: unprotected sex, sharing needles or other sharps, and passing from a parent to a baby during pregnancy, birth, or breastfeeding. It is not spread through the air or through water. Understanding these few routes is the heart of prevention. Just as important is what does not spread HIV, because fear comes from myths. You cannot get HIV from a handshake, a hug, or sharing a meal or dishes. You cannot get it from a toilet seat, a doorknob, a drinking fountain, or a swimming pool. It is not spread by coughs, sneezes, tears, sweat, or saliva, and insects do not carry it. There is absolutely no risk in caring for, sitting with, dining with, or comforting a resident who is living with HIV. Because we can never know for certain who may carry an infection, we protect everyone the same way using standard precautions, also called universal precautions. The rule is simple and powerful. Treat every person's blood and body fluids as if they could be infectious, every time, for every resident. This single habit is the foundation of infection control. It shields you from HIV and from many other germs at once, and it means no resident is ever singled out. Here is what standard precautions look like on shift. Clean your hands before and after every resident contact with soap and water or sanitizer. Wear gloves whenever you might touch blood, body fluids, broken skin, or soiled items. Add a gown, a mask, or eye protection when something could splash. And the rule people forget most: change your gloves and clean your hands between residents. Never carry the same gloves from one room to the next. Sharps and spills deserve special care. Never recap a used needle, and never reach your hand into a sharps container. Drop needles, lancets, and other sharps straight down into the puncture-proof sharps box and replace it before it overflows. Clean any blood or body fluid spill promptly, wearing gloves and using the approved disinfectant. Then place soiled materials in the proper waste. When you are unsure of a step, follow your community's policy. Even with great precautions, exposures can happen, so know what to do. If blood or body fluid touches your skin, splashes your eyes, or reaches a cut, act right away. Wash the area well with soap and water, or flush your eyes with clean water. Then report it to your supervisor or nurse immediately, not at the end of your shift. Speed matters. A preventive medicine called PEP works best when it is started within hours and no later than 72 hours. Now let's talk about clinical management, the care that keeps people well. Treatment today centers on antiretroviral therapy, a daily medicine that holds the virus down and keeps the immune system strong. Our role is to support that care, help residents take their medications on time, get to their appointments, eat well, and rest. Watch for side effects or any change in how someone is doing, and tell the nurse. Reliable, respectful support is what makes treatment work. This may be the single most important fact in the class, so remember it. When treatment keeps the amount of virus so low that lab tests cannot even measure it, that person cannot pass HIV to others through sex. Health experts sum it up in 3 letters and a symbol. Undetectable equals untransmittable. U equals U. It means effective treatment is not only good for the individual, it protects partners and the whole community. Treatment is prevention. Prevention gives us a whole toolkit. Condoms greatly lower the risk during sex. Never sharing needles or sharps stops bloodborne spread. There is a daily medicine called PrEP that protects people at higher risk before any exposure, and the emergency medicine PEP that protects soon after a possible exposure. And as we just learned, staying on treatment until the virus is undetectable prevents transmission entirely. Layered together, these tools are how we end new infections. Florida law does not only ask what we know, it specifically requires a focus on attitude and behavior, because how we treat people matters. HIV still carries unfair stigma, and that stigma keeps people from getting tested and cared for. So we lead with compassion. Use respectful, person first language. Say, a resident living with HIV, never a label or a slur. A diagnosis is private health information, not a defining trait. Treating people with dignity is part of the standard of care. Dignity becomes action through non-discrimination. Every resident receives the same excellent care regardless of HIV status. We never refuse care, never isolate someone without a genuine medical reason, and never treat a person differently because of a diagnosis. Standard precautions already keep everyone safe, so there is no reason and no excuse to single anyone out. The care, the warmth, and the respect are exactly the same for every person. Equal care, always. A resident's HIV status is private, and Florida law gives it special protection beyond ordinary medical privacy. Share it only with the team members who truly need it to provide care, and never in hallways, at meals, with family members, or with coworkers who are not involved. Keep records secure and screens turned away from view. Talking casually about someone's status is not harmless gossip. It is a violation of the law that can carry real consequences. Florida law also shapes how HIV testing works. Testing is voluntary and follows informed consent, paired with counseling so people understand their results. The law specifically directs that pregnant women be offered HIV testing because starting treatment early can protect the baby from infection. Ordering tests is not our role as direct care team members, but knowing these rights helps us answer questions with confidence and point residents and families to the right resources. HIV and AIDS are reportable conditions under Florida law. Healthcare providers and laboratories notify the Florida Department of Health, which keeps that information strictly confidential and uses it to track and fight the epidemic. Partner notification, reaching out to people who may have been exposed, is handled by trained health department staff, not by facility team members, and it is done without ever revealing the patient's name. Our part is simple: follow policy and protect privacy. Let's lock in the common mistakes so we can avoid them. Do not reuse gloves between residents, and do not skip hand hygiene. Do not recap needles or overfill the sharps box. Do not wait to report an exposure. Do not share a resident's status with anyone who does not need it for care, and do not let fear or bias change the care you give. Every one of these is simple to get right once you know it, and now you do. These rules apply across every palace setting. In assisted living and in skilled nursing alike, standard precautions, confidentiality, equal treatment, and the same Florida laws all hold true. The level of medical care may differ between settings, but the expectations for safety and respect do not change at all. Whatever your role, from care staff to dining, housekeeping, activities, or the front desk, protecting health and protecting privacy is part of your job too. When in doubt, speak up. Report any exposure to blood or body fluids to your nurse or supervisor right away, every time. Report a needle left out unsafely, an uncleaned spill, or a possible breach of a resident's privacy. You don't have to have every answer, you just have to tell the right person so it can be handled properly. Always follow your community's policy, and when something doesn't feel right, ask. Speaking up keeps everyone safe. So here is your role in 5 simple habits. Use standard precautions every single time. Handle sharps safely and report any exposure fast. Support treatment, because treatment that reaches undetectable protects everyone. Guard each resident's confidentiality as if it were your own. And treat every person with dignity and truly equal care. Do these 5 things, and you protect our residents, your coworkers, and yourself every day you come to work. HIV is preventable. treatable, and no barrier to a full life. And you are part of what makes that true at Palace. Thank you for caring with skill and compassion. This has been a Palace University training.